Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, back grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. In the past few years, there has been a gain in popularity in local patients going overseas for cosmetic surgery. There are many reasons for that. First of all, it's due to marketing, advertising, or the K-pop, K-drama that we do see. And secondly, the reasons for going abroad for surgical treatment is that sometimes cost could be lower compared to having it treated locally. They could take it as a vacation, had the treatment done, recover overseas, and come back without anybody knowing that they have surgery or treatment done. So I do see a growing trend in the last few years, especially that patients have surgical or non-surgical treatment overseas in places such as Korea, Taiwan, Thailand, Malaysia, and even Indonesia. Liposuction is one of the many procedures that patients often travel overseas to have the treatment done. However, I do see a growing number of patients returning Singapore with a botched or poor liposuction results. What are the risks of going overseas for the treatment? Why do they have botched results or poor results? There are many reasons. First of all, there could be a lack of regulations and clinical standards overseas. The doctors may not be skilled enough, and patients are often not aware of how experienced or good the foreign doctors are just by looking through their websites or social media. Next is the lack of medical follow-up. It is very important to have post-liposuction follow-up to make sure that you recover well, any issues and complications can be sorted or treated, and to ensure that you have a smooth recovery after liposuction in order to achieve optimal good results. So a lack of medical follow-up may impede or affect your recovery. Imagine that you have done your surgery abroad, and after you turn to Singapore, you find that there's some issues or some side effect complications. Who are you going to turn to? Another common complaint that I heard from patients is that when they had the procedure done abroad, they are often counseled or being pressurized to have procedure they do not need. Unfortunately, liposuction has one of the highest complications from patients being treated abroad. They often presented with uneven dents, depressions, asymmetry, lumps and bumps, post-liposuction tissue scarring, asymmetrical shapes, and skin discoloration. It is because liposuction is not about fat removal. You need to have a good eye for art. You need to be able to create naturalized contour, proportions, shapes, and lines. A three-dimensional sculpted shape in order to achieve a good, natural, optimized results. So very often, many doctors are not able to deliver that. Patients who have botched procedures, poor results, are often scarred psychologically. Imagine that you have paid huge sum of money having gone through the surgery, the pains and sufferings during the recovery, and you end up with a worse condition than before. The poor results, if not corrected, will be permanent. It stays with you for life. So patients often feel guilty, they feel unwanted, they feel ashamed, and will be unable to do the activities they wish to do or wear the clothes that they like. It may lead to physical and psychological trauma, low self-confidence, depression, low self-esteem, anger, and social phobia. How can you find a reliable clinic and experienced doctor to carry out corrective treatment? Corrective treatment is difficult and is tough. You need an experienced doctor with a good eye to carry out the procedure. So please read reviews on the clinics and doctors from previous patients. Choose the doctors who have experience treating conditions similar to yours, especially doctors who have done many corrective cases before. Go for a face-to-face consultation with the doctor. Get a feel of how the doctor feels about the condition, how confident he is. Communicate clearly and in detail the issues that you're facing. Make sure the doctor understands what you're looking for and be realistic with your expectations. So how does botched lipocorrective surgery work? It depends on what the patient is suffering from, such as asymmetrical shapes, uneven surfaces, lumps and bumps, dents, or scars. So basal liposuction utilizes ultrasonic energy to break up scar tissues from previous surgery with more ease and precision. It allows competent doctors to shape and sculpt the body into better conditions. Fat grafting may be carried out to smoothen out uneven contours, fill and mend indentations. Any excessive lumps and bumps or asymmetrical surfaces has to be corrected with sculpturing, liposuction, and others. Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them.